Hi, so thanks for coming today.
It's nice to be here.
Can you tell the students a little bit about, so tell them who you are and what you do.
Sure. My name is Casey Cottrell. I'm an adolescent medicine physician, and I work at Nationwide Children's, which is a local children's hospital. And I work in clinics that serve patients with eating disorders primarily and substance abuse problems, all for adolescents, typically ages 12 to probably mid-20s, somewhere in there.
Okay, so that's an interesting thing we've talked about in this course, is that we tend to think about adolescence as being 13 to 18, and really our adolescents start a little younger and kind of go up even into some of those, what we would have thought of as those early adult years. So part of this course we've been talking about different mental health issues, whether they're diagnoses or just general health issues that we see in youth.
Mm-hmm.
So if you could tell us just a little bit about what are some of those mental health issues you see in the youth that you serve, whether it be, again, a diagnosis or other types of issues you see?
So I see a wide spectrum of mental health concerns, anything from anxiety, depression, that can be pretty debilitating for some of our teenagers. I also do see a fair amount of kids with kind of an underlying disorder, that ultimately comes out of that, such as substance abuse or maybe an eating disorder. The other thing that I see kind of just general adolescents who have various psychosocial issues that might not quite meet criteria for a diagnosis of officially anxiety or depression, but they're going through a lot of issues and really struggling with a lot of different things that, may or may not have the adequate support that they need.
Yeah. I know sometimes, I think it's a conversation we've had in the past, how would an adolescent who was maybe seeing in a private clinic or some other primary care clinic, and I know like my kids will see their pediatrician through their adolescence, but what is it that often might differentiate an adolescent from being at a primary care to then doing primary care with you, a specific adolescent medicine physician?
So we do general primary care, so for kids who maybe don't feel comfortable at their pediatrician's office. So a lot of 17, 18-year-olds will really look at it and go, I'm not a little kid anymore. I want to go somewhere that gets that I am a soon-to-be adult. And then we also see a lot of kids for kind of those more specialized problems. So oftentimes those kids who have, again, higher levels of depression or anxiety or eating disorders or substance abuse, maybe your kind of typical medical home may not have a model where they can kind of care for that. So it's when you need a little bit more work on those things. We also do a fair amount of gynecology for kids too, so for kind of that female teenage population. And then we do a lot of contraception and birth control as well.
Yeah, so kind of a more specialized primary care for adolescents of a variety of, that are looking for a variety of medical care.
I usually tell teenagers, I'm a teenage doctor, which basically means I do anything that teenagers need, right? And kind of hit those certain areas that are a little bit more common during adolescence.
Yeah. So that would bring up, as you said, a little bit of the reproductive and sexual health. Do you guys also serve youth that are LGBTQ? Is that like a high population you see a lot that maybe they don't feel comfortable at another primary care, or they have those additional psychosocial issues that...
Yeah, we definitely serve as a medical home for kids who are LGBTQ. We also do a couple of vulnerable population outreach. So we serve for some medical care within our juvenile detention center. And then we also go to a local homeless shelter called Star House, where we also do a lot of care for those individuals. So trying to meet maybe those teenage needs where maybe they don't have that parent that advocates to take them to the doctor, but they still have unique needs that they need to be addressed during that time. I think the LGBTQ community as well is another one that has such vulnerability related to mental health concerns. Our team works within kind of a larger multidisciplinary team for that particular medical concern as well. And with that, we offer, support services to a multidisciplinary team, and we primarily look at hormone management for those kids, as well as any potential medications that they might need for anxiety or depression, and kind of work with psychiatry as well. So sort of kind of fit with the other folks who kind of provide care as well in that area.
Who are some of those members of that interdisciplinary team that are not just for your LGBTQ youth, but that population as well as some of the others?
Yeah, we work a lot with different different groups. We work a lot with psychiatry in our different clinics that we're in. For social work, I do a lot of work within my MATA clinic, which is my substance abuse clinic.
Mm-hmm.
We do a lot of work with social workers. We do a lot of work with social workers, both who are medical social workers and then social workers who are doing actual counseling and providing that care in different environments. Work with a lot of LPCCs or licensed personal counselors as well at different times. And then we do a lot of work with OT, as you well know. And then we will also kind of spend some time with massage therapy and a couple of other kind of disciplines. So we really cross paths with a lot of different folks at different times.
So kind of that's one of the cool things about being at the Children's Hospital is having access to all of those different.
We're very lucky.
Professionals.
Yeah.
So obviously you provide direct medical care across a variety of areas for a variety of youth. But how would you describe, what do you feel is your role as a physician in supporting the mental health of the kids that you see?
I think my role oftentimes is to be that medical voice who is helping tell either the child or the parent that this is something that is not fixed by medicine alone. I think I can be that advocate. You know, I do prescribe a lot of medicines, but oftentimes the medicines only work in concert with appropriate, therapy services and things like that. And for, better or worse, sometimes I can be that voice that maybe a parent or even a patient can hear more when the doctor says, you need to have this other support and this other help. I think that can be really something that gets them into those needed services. So I think advocacy, and then, I think the other place I hope that I am is a good experience within the medical community too, I think our teenagers are kind of forming their initial relationships and with the medical community and learning it. And if they, interact with physicians and other folks who are willing to listen to them and kind of take that time, my hope is it sets them up to have better interactions kind of lifelong down the road. So those are kind of the two areas I see that are maybe not measurable or hard to measure, but I think places that we can really help within adolescent medicine as physicians.
And I have two sort of final questions for you, but the first is, what made you want to be an adolescent medicine physician versus some other area of pediatrics?
So I went to medical school to become a psychiatrist. That was my original plan. And I really, I've always found mental health kind of care to be very fascinating. When I got into medical school, I really found I loved pediatrics. I loved working with kids. I also really liked obstetrics and gynecology, so doing gynecologic care for folks. And when I was done with med school, I gravitated towards working in pediatrics, and then really kind of at the end of the day, what I found out with adolescent medicine is it allowed me to do all of my passions. So I could provide gynecologic care, I could work with a population that is, young, and you're forming new relationships with these kids, and then I also really have the opportunity to do a little bit of mental health care. So it's a piece for me that really fits all of the areas that I both enjoy, and also that I do feel like I can make a big difference with these kids' lives.
And my last question is, what is your favorite part about working with, young people, with teens?
I think my favorite part is the unpredictability. You never know how they're going to answer a question or what they're going to, be thinking or talking about. And I think I'm humbled every day to remember not to assume things, to genuinely ask with curiosity, what are you thinking and what do you think about this? And I'm always astonished by what they tell you. And I like that it keeps you on your toes. So I really appreciate that part.
It's definitely an exciting area of practice. And as you said, they're so insightful and, and just so interesting kind of all the time. So, well, thanks again for sharing your insights and sharing some with us about your experiences.
Thank you.